Welcome everybody to another episode of Psychology Matters. I'm Sarah Karpie, your host, and I'm here today with Tammy Stone from Cumberland Heights. Tammy's here today to talk with us about effective treatment for addiction. So Tammy, tell us, there's something called EMDR, and I want to know a little bit about that. There's a lot of buzz around this, and I'm not familiar with it.
So EMDR is eye movement reprocessing and desensitization. It's a trauma treatment that we utilize sometimes at Cumberland Heights, and we use it for patients who have trauma. It's a process where you take the patient and you help them engage both their right brain and their left brain at the same time and put them into somewhat of sometimes it's a kind of a sleep-like mode where your subconscious and your conscious mind is engaged at the same time. We discovered it quite a number of years ago. One of our, a therapist in the field discovered it, and she discovered it by when she was out walking. And she realized that the tapping or the back and forth movement of walking engaged both the left brain and the right brain at the same time, in the conscious and the unconscious brain. And what that helps us do is process trauma. And it helps us understand that we can begin to connect the unconscious brain, which is usually how we process trauma, and make sense of the negative cognitions that we attach to traumatic events a lot of times, to a positive cognition which we have whenever we are in our conscious mind. And as we do that, it helps the patient not have to relive the trauma over and over again by talking about it, which is sometimes what we used to do a long time ago when we tried to treat trauma, which was re-traumatizing for the patient.
Sure.
So it helps the trauma treatment process move a lot faster. The desensitization process takes all the emotion out of it. It doesn't help them forget the trauma, but they don't have quite a lot of emotion and emotional deregulation around it. So they are able to be desensitized from it and begin to learn better skills, better coping skills. It's not a magic bullet by no means, but what it does is it gives them an opportunity to be ahead of the game so that they can begin to learn coping skills to deal with it once the emotion's taken out of it.
So explain it just a little bit more. So you're doing some movement?
Yes, you can do a number of things to engage the conscious and the unconscious part of the brain. You can either do a light beam where the eyes are following the light beam back and forth, or you can, we started off a long time ago just by following your finger back and forth, okay? You have hand paddles that you put in there and engage, they paddle back on the right hand and the left hand side, or you can put earbuds on and listen to beeps in your ears, or you can do all three of those, or a combination of any of those. And what that does is that activates the left side of the brain and the right side of the brain and engages that to help the client engage the brain, and then they talk about the pictures that they see of the traumatic event until they begin to fade away. And as the pictures begin to become present and fade away, so does the negative cognition that they have attached to it.
Very interesting. That's fascinating to me. Not really familiar with that. I'm glad you shared that with me. So that's just one of the treatment modalities that you use at Cumberland Heights. Tell me about some other modalities that you're using there.
Well, we have a couple of therapists out there trained in somax therapy, and that's somatic and expressive therapies combined together. We found that our patients do really good with that type of therapy, and it's about grounding and expressive therapy to keep the trauma brain engaged. And so they would do things like they would do resourcing, and resourcing is about teaching them to be activated with things like sensory, smell, music, tactile sensory. Sometimes we'll find that we all do resourcing. From a very young age, as children, we'll do resourcing. We might rock. We might like to iron. We might like to write, to color. We might like certain smells. And we found that children do this coming out of the womb. but there are soothing mechanisms that we do. And when we've been traumatized, we reach for those things. And sometimes when we do them, when we've been traumatized, we might do them in a negative way, and we need to learn more positive ways to do them. And so when we teach our patients that whenever they're dealing with their trauma, that we do that slowly. We learn to help them ground themselves by resourcing. And so as they're talking about their trauma processes, we are teaching them how to ground themselves slowly that way. And that helps them work themselves through that trauma by doing that. Other things we do is expressive arts, like art therapy and music therapy, equine. So in art therapy, we would have them do different types of art projects where they might identify either the traumatic event or how they feel on the inside versus how they feel on the outside, using different types of artistic materials, like maybe things that they might find out on the campus. They might do meditative art, like mandalas, meditative coloring mandalas, where they'll just start off and they'll color and meditate for a different period of time. But it also teaches them that they don't have to be perfectionistic, that they can be creative. Music-assisted therapy helps them tap into that part of their heart and their soul where they're writing songs or writing poetry. They many times will play with, we have a music-assisted therapist who will help them create a music piece. And then they will record it and then play it back for the community. And a lot of times you'll see our patients just come to life because they didn't realize just how talented they were.
Sure.
Equine therapy is, or even a lot of times we'll have puppy day, you know, and so we find that our patients are connected to animals, and they will, in equine therapy, we find that the horses mirror their different emotions, so the patient can get in touch with and learn a lot about how they're feeling just by watching the horse and how the horse is responding to them. If they're feeling anxious, the horse won't respond to certain instructions.
Right.
And it helps the patient begin to slow down and identify that. And then they also just get a lot of joy out of just touching and feeling and getting connected with the horse.
Sure.
And the same thing, what they found is just they just love the touch of the puppies. Whenever we have, sometimes we'll have a local lady who raises retrievers bring her puppies down whenever she has a litter of puppies, and they just get to enjoy them for the day, just to love on them and stuff like that, and they feel so connected to them. We do sand tray therapy, and sand tray therapy is where we give them a particular intervention. So we would tell them to like show us maybe your relapse, or show us your conflict with a loved one in the sand tray. So if they're having trouble expressing something verbally, then they can non-verbally draw that scene out in the sand with little miniature people and props of different kind, and then they can come back, and then that process of doing it, staging it in the sand, then helps them have a time to process it, and then they can come back and explain to us what they're seeing and what that meant to them. And it gives them an opportunity to get it organized in their head before they then have to say it. So sand tray therapy is very effective for people who haven't yet found the words or the emotions yet to express themselves.
So is the sand tray like a table with sand in it, or how to describe the sand tray to
It's
us?
actually, it's one of those clear bins that you store clothes in.
Oh, I know what you mean. Yeah.
And it's sand. And we use things like Hot Wheels. You know, we go to yard sales, and we'll find Hot Wheels and different kinds of little miniature props that you use in doll houses and stuff like that. But you can buy kits too. But we find all kinds of creative things to use for that. And they will create a scene in that little bin, and then they can then come back and explain to us what that scene was for them, or that event. Maybe it was a painful Christmas, or maybe it was, you know, a death, or some sort of grief that they're suffering, or just a struggle that they may have had. And then we'll process through that. Or maybe it's a hope or a dream, what they, you know, their life before before recovery and their life, before their use and their life after their use, or what their life is since they've been using and what they hope for it to be after they get sober.
Very neat. So basically a type of art therapy using sand and manipulatives.
Yeah.
That's really neat.
Yeah.
So tell me more about sensory treatments that you use, other sensory treatments.
Other sensory treatments might be things like smell and tactile. We found that our patients like any number of things, like we have lots of rocking chairs spread all throughout the campus, and even sometimes in the group rooms, because that we found that movement, they like the movement. Most of our different departments will have things where we can have like the smell of lavender or peppermint or different smells, because we want to lower their anxiety. We also have things like, we found that the feel of washcloths, that kind of rough, gritty feel, they like that.
Who would guess?
Yeah. For our clients who have a history of self-harm, we will give them like prickly balls, because they want that sensation of the prickle, but they are not harming themselves any longer.
Sure.
So we will give them that, or maybe ice cubes, or things that won't actually harm them, but they will get that dramatic sensation to help them begin to learn different ways. Music. Different types of music we found, even sometimes just poetry, or that music of some sort, or different quotations or things like that they can hold close to them. Pictures of different sceneries, or meaningful pictures that they might have of something that they brought from their home, or someone that gives them inspiration, is also another thing that grounds them a whole lot.
That's great. Let's talk a little bit about relapse as part of recovery.
So there's a couple of things that we have in recovery. There's relapse, and then there's return to use.
Okay.
And sometimes that's confused. Return to use is where a client may not have had very much clean time at all, but they've used. They may have either used while they were in treatment, maybe in an outpatient setting of some sort, or even managed to find a way to use while they were in an inpatient setting, or they left treatment and they started using just as soon as they left treatment, unfortunately. And relapse is defined that they left treatment, they were actually actively working a recovery program, they had a sponsor, they were going to meetings, they were actually doing the deal, and something happened. They maybe had an event, a traumatic event, something happened, maybe they had conflict with the boss, they moved, changed locations, and didn't get a new recovery program started when they changed locations.
Which can be traumatic.
It can. Maybe even got a promotion, and they just didn't know how to handle the stress.
Positive stress can be traumatic too.
It can sometimes. And they had an actual relapse. And so those are two different things, and they need to be treated differently. So if we're talking about a true relapse, then we need to go back and look at, where did my recovery process, where did I let go of, and where did I not cling to that process? What did I start to let go of early on and not continue on? And what do I need to go back and redevelop some skills around to move on and continue on with that process? I haven't forgotten all the things that I learned in treatment. I don't need to go back and relearn all those things again. I don't need to go back and repeat all that stuff again. So we don't need to treat them as if they've never been to treatment before. Now, if they have a return to use, we need to talk about, what was your resistance to developing that recovery program that we talked so much about while you were in treatment? You know, what was your resistance to following through with that continuing care plan that we talked so much about? Because sometimes we think that, 30 days in treatment is enough, that we don't need to go on to the next level of care, that we don't need to follow through with that aftercare plan that people have told us that we need to follow through with. So what was that? They're two different things.
Sure. They think, I've got it, and they don't necessarily have it.
Yeah.
You mentioned in another episode, and if our viewers didn't see it, very often you're recommending that the patients stay a little bit longer than 30 days. Can you talk about that?
Yeah, we have different levels of care, and extended care is one of the things that we talk about a lot of times. And extended care is sometimes a 60 to 90 day process. And that's for our clients who actually have had maybe trauma, who have never been in treatment before, and who need like that extra little bit. Maybe they have a co-occurring disorder like extra depression or anxiety, and they are going to need some extra support, extra structure in order to make sure that that recovery process is solidified. They need opportunities to practice what they learned in the first 30 days in the real world, but with some structure around that. So they're going to get looser treatment, but they're going to, where they can actually go out to meetings, they can live in a house with other recovering people, with a staff member around, but that staff member is not going to be fully staffed. They're going to get to cook their own food. They're going to get to go places and try their recovery wheels, if you will, and see how they're doing. And then they're going to come back and they're going to talk about how hard it was that day, what it was like to walk into the grocery store and see the beer cooler, what it was like to go down maybe to the local area where, you know, I heard my favorite song that I used to, you know, go and use to, or whatever it was. What it was like to call my girlfriend on the phone for the first time, or my boyfriend on the phone for the first time, and actually hear their voice, and maybe they didn't get sober like I thought they were promised me they would while I was out, or have that first argument and have that safe environment to talk about it in.
Sure, so living with those triggers and learning how to, you know, communicate with people that you've, you know, had as triggers before in your life. So figuring out how to live successfully in recovery is something that everybody has to figure out. So tell me about, you know, there seems to be some confusion about harm reduction model versus an abstinence model. Can you talk a little bit about the difference between those two?
Well, there's a couple of different types of harm reduction. There's medicated assisted harm reduction, which may be like in the opiate-based world, that might look like a type of Suboxone, Subutex type of medication, where the doctor would give you medication and they would take you off opiates, but they would give you this medication, and it would help your cravings, and you would go to the doctor on a regular basis and take that prescription. And then there's also, well, I'll just use less than the drug that I've been using, or maybe I'm addicted to opiates, but I don't drink, overuse alcohol, so I can continue to drink, but I just won't use opiates anymore, or I won't use marijuana anymore, but I can legally drink, so I'll just drink. That's harm reduction. In the world at Cumberland Heights, we believe in abstinence-based, and what we believe is that if you are chemically dependent, if you have the brain disease of addiction, any kind of mood-altering substance will reactivate that disease. And if you reactivate that disease, then you are going to continue, and you will go back and eventually end up back in a abusive relationship with drugs and alcohol again, which will eventually end up back to a destructive lifestyle. So we believe in abstinence-based treatment. And so our goal is to detox you safely. So we do use medication to detox you, but our goal is to very quickly, once you are stable, to get you off all mood-altering chemicals as soon as possible. Now, we do use medications to help manage mental health issues, but we use medications that are not mood-altering. They are mood-stabilizing, and we try to utilize physicians and psychiatrists who are informed about addiction, so that they understand that, and help our patients understand the process of recovery.
Sure, because a lot of times we do see co-occurring substance use disorders along with mental health problems. So having physicians work with you who believe in your model, or, you know, is probably very helpful.
It is, yes.
Yes, absolutely. So tell me about successful recovery programs. What are the parts of a successful recovery program?
Well, we've been toying around with this for a number of years, and we've found a number of things that work for us, And some of those things look like, we found that a 12-step programs work well for us. We found that one of the things that also is similar to a 12-step program that works well for us is dialectical behavioral therapy skills. We found that daily living skills from dialectical behavioral skills and recovery skills work well. We also found that seeking safety, because a lot of our patients do have trauma, seeking safety is a evidence-based treatment modality that treats both trauma and recovery patients. And so we treat the trauma and we treat the addiction at the same time. And it's evidence-based with that, so we teach them recovery skills and trauma treatment-based skills at the same time. So those three different types of skills are all very similar. So we have different groups that our patients go to that learn those different skills throughout the day and help them to kind of teach those daily living, real basic kind of living skills that are about containment, about communication, about meditation and mindfulness, about conscious living, about expressing their emotions in an effective way, that are very helpful for them to do daily practices. And in the beginning, that's really what they need to focus on. And then as they get kind of their sea legs up under them, then we begin to add more complex things. But in the beginning, that's basically what we want them to focus on.
Can you tell me a little bit more about mindfulness? What is that? How do people practice mindfulness?
Well, mindfulness for our patients is, our patients either spend a lot of time thinking about the past or spend way too much time in the future. And so what we want them to do is learn how to spend a lot of time in today and a lot of time in this moment. And so what we do is we try to help them concentrate on that. And mindfulness practices will be about those kinds of things. It might be focusing on just this moment right here, right now. And it could be meditative walking, it could be a meditative visualization, it could be actually kind of just sitting and meditating. But it's any number of ways that they can just stay focused on right here, right now, so that they don't get lost in the past or get too projected into the future. If you give our patients too much time, they will be solving next million years' problems, or they will be wrapped up in all the things they shoulda, coulda, woulda done.
Shoulda, coulda, woulda.
If they would have had the opportunity to do it over again.
Absolutely.
So, and that's part of their disease, and we know that. So we just want them to really learn to focus on that. So they like the opportunity to meditate. We do things like Aikido, which is mindfulness martial arts type of practices. We'll do yoga. We'll do mindfulness proper types of things. Like I said earlier, we do the mindfulness mandala coloring. Then they do, like I said, mindfulness walking. Mindfulness sitting meditation types of things, mindfulness visualization. You think, oh my gosh, are we going to do one more mindfulness activity today? But they do enjoy it because what they found is it slows them down. It slows that mind down just a little bit and gives them an opportunity to kind of be present with themselves.
Very, very good. So basically brings them to the present and helps them focus on what's going on right now.
Right, which is interesting because one of the things that we have found that is one of the most effective treatment methods for trauma is the presence, is being present with somebody.
Right.
And if we can teach them how to be present with themselves, then their trauma reactions are reduced just automatically. So we are giving them a trauma skill treatment process within itself, just in that mindfulness process of being present.
So not reliving that past trauma over and over again,
Exactly,
but
yeah.
being present.
Yeah.
That's really wonderful.
It's just a simple skill, and it's amazing how much bang we get for that little skill there.
That's amazing. Can you talk just briefly a little bit more about DBT?
So DBT is dialectical behavioral therapy. It is a set of 4 skills that we teach our patients on mindfulness, distress tolerance, emotional regulation, and effective communication. We teach them these different skills because we found that those are the things that whenever they're under stress, that they're struggling, that many times that they've used alcohol and drugs, that they've lost the ability to have these different skills. They're kind of everyday skills that most people pick up on as they're growing up, but when they're using alcohol and drugs, or maybe they've suffered a trauma, that they don't do very well. And they need to maybe go back and learn these social skills. As I mentioned before, the mindfulness, I've already told you all about that. The distress tolerance is where they need to learn how to manage their emotions whenever they're feeling upset. Emotional regulation is, again, another way to manage their emotions when they're feeling upset. And interpersonal effectiveness is about communication. It's about how do I express myself whenever I'm feeling upset. Instead of coming in and demanding or blaming others for how I'm feeling or how the world is not going my way, I can take personal responsibility for having a positive outcome for myself. And many times our patients, when they've had stress in their lives, don't understand how to do that.
Well, thank you so much for being here today, Tammy. That was great. We have Tammy Stone here with us today. She is here talking about addiction treatment, effective addiction treatments. This is Psychology Matters. I'm Scherer, your host. I hope you'll go out to YouTube or Facebook and see us and give us your comments and feedback and let us know how we did today. We'd love to hear what you have to say about these episodes. Thanks for joining us.